Good afternoon. This is Dr. Linda Slak. I'm a chiropractor practicing in Burlington, Massachusetts, and I specialize in pediatrics. Primarily, I take care of many infants, about 80% infants, and the rest of my practice is taking care of children with neurodevelopmental disorders. So in that respect, I see a lot of babies who come in to me because they have been diagnosed with something that we call a tongue tie. And I have the pleasure today of having a wonderful guest, a wonderful mom who asked me to do this, come on with her, because she sees so many moms struggling with this issue, not knowing what to do when their infant is having difficulties with breastfeeding. So we're going to start. This is Christina, and I would like Christina to tell us her story. So we're going to start with that.
I'm Christina. I have a 6-month-old daughter, Juliana. And when I had her in the hospital, one of the NICU nurses said, I think she might have a possible tongue tie, like just check into it before you leave here. And I had a little bit of trouble with her latch in the beginning and had to use a shield and whatever. But when I asked about it, I was told, nope, she's good. They kind of peeked in her mouth, like, nope, you're good to go. And I didn't really have issues breastfeeding her until day 5. Started with the whole, she spit up a lot and would be like, spitting up a lot and everything. So when I asked her pediatrician about it, she looked in her mouth, was like, nope, she's good. She's gaining weight so well. She doesn't have a tongue tie. That's nothing to worry about. Well, over the first few weeks of her life, the spitting up got worse. She became gassy and just like overall, just like nothing felt right. So then I kept pushing the issue. And then finally, after asking 2 different pediatricians there, everyone said, no, I did my own research and came to the conclusion like, no, something's not right. She doesn't just have reflux. She's not just gassy and uncomfortable, and something's more to this. So then I took her to a pediatric dentist, and lo and behold, she has tongue tie, lip tie, and buccal ties. So
Let me ask you a question.
yes.
Before that, had you consulted with a lactation consultant at all?
So I was seeing a lactation consultant through the hospital. And again, they said, nope, she's gaining weight. I mean, she was gaining like 10 to 20 ounces a week, like gaining weight like crazy. So they're like, no, like no tongue tie. I actually saw the hospital lactation department like 2 or 3 times. It wasn't until after I had a good idea that she had a tongue tie that I saw my own like sought after IBCLC. But I'd already started the process with the pediatric dentist
Okay,
and learned after the fact that I should have started with an IBCLC.
sure. So you went to the pediatric dentist and they found not only tongue and lip tie, but buccal ties as well, correct?
Oh, that's what they're called. Okay.
And
Yep.
did they release them right then and there? Is that
No.
no?
She just gave me the rundown of all the information, said what she had, and then it was up to me to decide if I wanted to move forward with it, and I scheduled it for a couple weeks later.
Okay. And what did you do? Did you do anything else before the release?
So I forget exactly when. I want to say it was around like 5 weeks. I had taken her to the chiropractor I saw during my pregnancy, who works on infants. Just because in general, I wanted to take my newborn to the chiropractor for those benefits. And so I took her to there. So she was getting weekly adjustments in general, but not specifically for the tie.
Okay. And so then a few weeks later, you went in for the ties.
Yes.
And so the chiropractor was checking the baby for interference in the nervous system, correct? But not really doing any prep work for the tie release. Okay.
No.
So then you went to see the dentist and you had the release.
Yep.
And what
And this is when I switched to someone who I thought was more versed in tongue ties. When I called and asked them, like, are you familiar with them? She's like, yeah, we treat them. So I said, okay. And I kind of just was like, this is what I need to do for my daughter, put my trust in her. And they didn't do anything wrong. It's just, unfortunately, she just wasn't as familiar with them as I hoped. So I saw her for 6 weeks. We went once or twice a week. And then at the 6 weeks mark, I was like, things are getting worse almost, like just something's not right.
Yeah.
And it's when I called you.
So immediately following the release, what improvements did you notice with Juliana?
I didn't notice anything dramatic. Like a lot of people say, like, oh my gosh, everything just, changed in an instant. But I will say, over the, like 1 or 2 weeks, her spitting up was a lot less, and she just seemed a little bit more content. So I think, overall, it definitely was an improvement, but there was still something.
Right. And what got worse? You said things got worse. So what was
Yeah.
worse?
So it kind of like looped back, the spitting up got better and then it got worse again. And then she started doing the arching of the back, which she hadn't really ever done much. She started arching her back and like grunting like crazy. And I could just like tell, like, obviously I don't know, but I could just tell like there's some tension here in her little body, just like, I don't know, things like that. And, it went down the path of, oh, it must be something you're eating, or she has reflux, just kind of went back into like, oh, just that's what it is. That's what babies do. And
So how did you determine at that 6 week mark, then after the second chiropractor, like what made you realize that possibly you could do better?
so when I was like, again, back on my research, I do a lot on a lot on Instagram, which I know sounds crazy and incredible, but there's a lot of great accounts to follow. And I saw a chiropractor treating for tongue ties and putting her fingers in her mouth. And I was like, wait, none of the two previous chiropractors I've gone to have even like talked about going into her mouth. Like, what am I missing here? And then when I dug a little bit deeper on a Facebook group for tongue ties, I realized like the craniosacral work and stuff like that. And I think there's a few other things that you can try that are a little bit like are important. And I was like, wait, I need to try something more for her. So
Awesome. So that's when you came to me. So it was like she was about 4 months old when she
yes.
came into my office. And if I recall right, after examining her and sitting down with you and going over the findings, I said, we're pretty much starting over.
Yeah. You're like very restricted.
So, so tell us what happened from there. That was really a hard decision for you to make because you had already put your trust into two other doctors and weren't getting the ideal results that you
Right.
had expected.
I will say, like, just in that Facebook group, like, you came highly recommended, so it made me a little bit at ease. But honestly, like, having done, she got diagnosed with the ties at 8 weeks, and now we're at week 16. I was like, I've come this far. I've done so much with her. We got the procedure. We've done chiropractic care. I'm not giving up now. I'm going to try whatever I need to do.
Right.
And I just had this feeling that you were the right place to be.
And what happened following that after she started coming?
So we went to you like twice a week for a while, and I just felt like at some point, like things started shifting. She wasn't doing the arching of the back as much. She was sleeping better. She had more regular like bowel movements, like going to the bathroom was better. She just seemed a little bit more relaxed overall. And even like till today, she's just overall just like a really happy baby. Not that she wasn't before, just I think overall it just rounded her out really well.
Awesome. And she's eating fine. And
Yeah.
so let me just touch on a few, maybe 1 or 2 points that through your discussion. And one of them was, that the doctors said that she was gaining weight fine, she was eating fine, she was taking in good nourishment. And that is a common thing that most pediatricians, when you go for your well checks, that's what they're looking for. They're watching the weight gain, that the infant is growing properly. And oftentimes with an infant who has ties and inability to coordinate their suck, swallow, breathe reflex, they will, usually it's the mom has a good supply or an oversupply. So they're getting enough milk, they're getting enough nourishment, but if the mom had a supply issue, that wouldn't be the case.
Right.
So On that note, we need to also recognize that every infant is different. So ties are the same, but every infant is different, and the trajectory of how they progress through care. Like some infants will have a tongue tie release and have a really difficult time. Sometimes it will reattach and they need to go for a second procedure. Sometimes they will just become more fussy at first, and then you have the infant who they get the release and it's like magic, right? They go right back onto the breast. All the issues that the mom was having go away. So let's start by talking about what a tie is, the different types of ties that you may have heard about as a parent. And then we'll go on from there as to what maybe some of the symptoms that result in right at the start or through infancy, and what happens, like, what the correct order of care should be for ideal care for the infant. All right.
Okay, perfect.
So if we begin with tongue tie, the frenulum of the tongue, we're just going to talk about the tongue, at about 14 to 16 weeks of gestational age, the frenulum will either thin out or recede. And as it does that, so that frenulum is sitting underneath the tongue, connecting to the floor of the mouth and allowing the tongue to then, as it recedes, the tongue can then lift and rest on the roof of the mouth. This is really important at this stage because as it does that, it'll allow the palate to smooth out and become normal shaped and not be high or a high bubble palate. Sometimes we see in the infant who has a tie because that tongue was never able to lift and rest onto the roof of the mouth. So many of you may have heard that when you go to an IBCLC or a dental provider or a chiropractor, they'll ask you to check your infant while they're sleeping. Just press down on their chin and look to see, is that tongue resting up onto the roof of the mouth? And this can be done with older children too, whose ties weren't caught earlier. So then we're going to look at, so what is a tie? So we have that if the frenulum does not recede at that 14-week mark, you have the infant using that tongue inappropriately and improperly for the rest of their growing phase until they're born. So parents think that this is a problem that initiates at birth or after birth, but it actually starts way back to that 14-week mark. All right, so that if we consider that, that is why we the infant has already compensated for using the tongue improperly. That's why they have difficulty in doing something that should be just instinctive, right? Feeding should be an instinctive thing. So now we're going to look at the tongue. So you asked, like, what's a proper tongue evaluation for an infant? And that would be sitting on a table with your legs straddled over with the baby's head in between your thighs, right? Upside down. And you're, of course, as a provider, I always wear gloves. So I'm going to put my gloves on. I'm going to go into the cheeks. I'm going to lift and then lift up under the tongue, get deep under there. So you've heard of an anterior tie. An anterior tie is something that's often mostly picked up right at birth in the hospital. Like the pediatrician, the nurses, they're gonna see that right away. They might even call an ENT in to just go snip it right away. An anterior tie means that the frenulum is attached at the tip of the tongue or between the tip and the middle of the tongue. So you may see a heart-shaped appearance. You'll see the tightness when they lift their tongue. You'll see an indentation that we call heart-shaped appearance of the tongue. And then the harder tie to define is what we call the deep posterior tie. So that's why we really have to go look at the infants, get in there from the head and go in and really go under the tongue and lift. And then we can see a deep, thick cord, a posterior tie. And there's different ratings of those ties from 1 to 4. In severity. So the dentist will classify that tie and usually will tell the parent, oh, it's a class 4 tie, it's a class 1 tie. So that, but oftentimes I hear moms say, well, I was told it was just a little tie. Have you heard that? So when we hear that, it's just a little tie, it's up to you whether you want to do anything about it or not. Well, then really what we need to look at is function of that tongue, because we can have a tongue tie, but we can have full function of that tongue. And if the tongue is functioning properly, then there's no reason to go in and do the procedure of any kind, right? So we need to assess and make sure, and we know pretty much right from the start, if the mom's having difficulties, that's a red flag saying that no, there is an issue here, but we're going to look and check. So the first provider that you should see to have that evaluated truly should be the IBCLC, the International Board Certified Lactation Consultant, who is savvy with tongue tie. So as a parent, when you're calling the lactation specialist or consultant of any kind, you need to say, do you take care of babies with ties? Almost everyone in this area, in the Boston area, probably sees lots of them because it's very prevalent here. So, and even go further, like how many children have you taken care of with this, right? So then you go to the lactation consultant, then they will be the one to advise the parents to say, you need to go to see the body worker. And chiropractic comes into that classification, but chiropractic is unique in that no other provider or body worker is going to address the nervous system, which is so important because the nerves from the upper neck, especially that they flow out to supply and give function to the tongue, to all of the muscles of mastication. And so we need to make sure that there's no interference within those nerves. And very commonly that happens in the birth process, even in the best of situations. So if we have an infant who's had a traumatic birth, that's going to give us a key that we probably have some tension within that nervous system. Also, so the frenulum, let's talk about what it is itself. So it is part of the fascial system. That fascia is, you can think of it as a spider webbing that sits underneath the skin, attaches everywhere, goes in through the organ systems and all the way down to the feet. So sometimes I'll hear somebody say, oh, my child's toe walking. Now, toe walking could be a sign of a retained neurological reflex, but it could also be as part of those ties because you've got this tension that builds up throughout the whole entire body. So now the lactation consultant will then, a good lactation consultant will give you references. That's where your references come from. They'll refer you, they'll give you names of good, what we call preferred providers, whether it's the dentist doing laser, and there's also ENTs who release ties. And people say, what's better, the dentist procedure or the ENT? And really, it is more the expertise of the provider versus, but with a deep posterior tie, I think it's better to have a laser procedure because they can get in deeper for it. A lot of infants may need to go back for a second procedure if it's a very deep posterior tie. Okay, so those are the two providers that would deal with the ties. And then the IBCLC is also going to recommend body work of some form. So craniosacral therapy, chiropractic, and that's why I combine the two in my practice so that parents don't have to run to all different providers. So why do we need both, or why is it necessary? And before the release and after. So let's talk about the before care. Before the release, we want to relax all the tissues. We want to relax all the tissues from head to toe. We want to get everything nice and supple. The dentists particularly say that they get a nice deeper release, less chance of reattachment if the infant has body work prior to the release. Now, there's all different types of tensions. We can have an infant who's super tense, meaning that mom and dad say, little Johnny at birth was able to lift his head up right away. Head control was there from day one. Was rolling onto his side, maybe even rolling onto his stomach right at the beginning of birth. And we think, oh, Johnny's really advanced. He's doing so well already. That is actually a sign of super tension. That infant has a lot of tension within their body, and they're not supposed to be able to do that at birth. That's an acquired skill. So I'll explain to the parents that we want to take all that tension out. And as Johnny relaxes, he's not going to roll over anymore, but he'll roll over at the appropriate time, which is about 4 to 6 months. He's going to start to do that. So
That's
you
actually
want to take
interesting.
those tensions and stresses out of the body. But
Yeah.
when we release the frenulum, especially like the tongue frenulum, okay, so the tongue connects to this little bone underneath the neck. It's called the hyoid bone. And then it's connected to the whole fascial plane that goes down the midline of the body. We call a tongue tie a midline issue for that reason. And so from head to toe. So think about, we've got this, there's a rubber band between my two fingers and I've got it stretched to maximum tension, right? Really, really tight. And somebody takes the scissors in the middle and whoosh, cuts that rubber band. And what's going to happen? Whoosh. Okay, so let's talk about the tongue after it's released. So the tongue's released. Now the infant has this tongue that's moving all over the place. Sometimes I'll call it a floppy tongue in the beginning. And so it's discoordinated in the very beginning because they're like, whoa, I've got all this motion and movement now. I don't know what to do with it. They need to relearn how to correctly reorganize that tongue motion movement. And that's what, in addition to the stretches that the dentist gives you, the IBCLC or the chiropractor or the body worker will also give you functional exercises to do to not only to improve the motion of the tongue, to make sure that it heals well, to make sure that it's functioning and strong. Okay, and how long does that take? So the tissues probably take about 2 weeks to fully heal. You'll see that, you looked for, remember the diamond appearance underneath the tongue?
Yeah.
And then good 6 weeks or more for the tongue to be functioning properly, moving laterally from side to side, giving you good resistance when you press against it side to side, and lifting the way it should to the roof of the mouth. And also we want to make sure that the infant is breathing through their nose, sleeping with their mouth closed. Okay.
Yeah.
Now, but we don't think about, and this is many parents don't think about the rest of the body, because remember I told you that fascia is connecting everything all the way down. So we just went psh, and then so the body goes whoa, and then it's going to start to tense up again, right? And as it's reorganizing, as the fascial planes are reorganizing, we want to make sure that there's no strains or compensatory strains within those planes. And that is the reason for body work in the way of myofascial release or craniosacral therapy, to take care of that and make sure that everything reorganizes appropriately. And then the third component as a chiropractor, and the most important one in my opinion, is to make sure that we have proper functioning of the nervous system. So it was really great that you started chiropractic care very, very early. And parents that know this will bring their infant to the chiropractor right at birth, because because that birth process and pulling on the head, no matter how the head comes out, even in a C-section, there's a lot of pressure placed onto the upper neck, and that upper neck intention can cause a lot of the symptoms that we see with ties. So, mom goes and what about the mom whose baby has colic and reflux, but there's no tie, right? Those are stresses and strains within the nervous system, pressures on the nervous system that once released, we often see those issues go away as well. Does that make sense?
Yeah, no, it's so interesting.
So those are things that, parents do not usually know. And so let's look and see some of your other questions. I think that's like a good start.
Yes, definitely.
You had questions about what, like how do you know when a toddler has it, or let's talk about some of the signs and symptoms maybe, and then we'll wrap it up.
Yeah.
Okay.
Yeah. Sounds good.
So signs and symptoms that the infant's going to have, they're going to have like inability to suck, possibly. So they can't suck on a finger. They can't latch onto the breast. They can't latch onto a bottle. And then That's going to lead to, when we have a high palate, we might draw in more air. So we're getting more air and it's going to lead to gassiness,
Mhm.
colic potentially. The baby's going to become fussy and frustrated because they can't get a good latch, and it's going to be a shallow latch. So as a shallow latch, what's it going to do to mom? It's going to cause
Pain,
pain, bleeding, cracked
damage.
nipples, lipstick,
Yeah.
lipstick appearance of the
Mhm.
nipples. So it's going to um, create disharmony between mom and baby.
Yeah.
And in that note, on that note, then you go to the pediatrician. The pediatrician says, a mom just told me this yesterday. She said, my first pediatrician told me it's okay if Vincent can never lick an ice cream cone. No problem. That's about all that's gonna that's all that's gonna happen, if you just do nothing with his ties. So she said, really? She said, when I think I want Vincent to be able to lick an ice cream
Yeah.
cone at the very least, right? Then
Yep.
we have clicking, dribbling, choking, gagging,
Yes.
all of those things that go along with the inability to not be able to coordinate suck, swallow, breathe motion. So if an
Yeah.
infant can't use their tongue appropriately to suck, swallow, and then breathe, they're going to be distressed. There's going to be more tension forming in their bodies, and we're going to see oftentimes a very distressed, unhappy baby and
Right.
unhappy parents. Because what happens, do you know that feeling when your baby's screaming, goes from 0 to 100? I've seen it with Juliana
Yeah.
way back
Yes.
when. And, all of the time, parents are like sitting there going, oh, you know, um, their like insides are being ripped apart, but it's like, oh, it must be feeding time or nap time. It's an embarrassment in a way.
Yeah.
But I see it all day long. So it's not. It's like I say, relax, because we're going to see everything change over time.
Yeah.
So really important, number one, that you, to reiterate, that you go to the proper order. So it would be the IBCLC, and after the release, you need to go back to the IBCLC because they're going to help with positioning, with getting that deep latch, and the chiropractor and body worker is going to help to restore normal function so that the IBCLC has an easier job of making that happen. And the providers should interact and speak with each other too. So if there is an issue, so if I see a reattachment, which I rarely do, but when I do, I will message the provider and say, hey, I'm going to send Mary back to you to be reevaluated to see if we need to do a revision of that release that was done
Gotcha.
before. And that happens occasionally.
Yeah. That made me think, before we wrap up,
Yeah.
a lot of the conversations and the things that you see about tongue ties are centered around breastfeeding. But obviously, as you know, if you don't treat tongue ties, it can cause problems later down the road with speech and dental health and all those things. So I
Yes.
guess for the moms who are bottle feeding, either exclusively pumping and bottle feeding or formula feeding, what should they be looking for? Because I feel like a lot of those probably go undiagnosed if you're not working with an IBCLC, you're not having that nipple damage and all that stuff. What can they look for?
That's correct. And actually, in the past, when breastfeeding wasn't really in vogue, and many moms were only bottle feeding it, we didn't pick up ties, right? Because
Right.
they can get away with feeding from a bottle. So they should be looking for similar things, not being able to latch onto that nipple, like
Okay.
maybe the baby where the parent has to try like 10, 15, 20 different nipples before they find the right one.
Okay.
As a parent, you can look in the mouth and feel that palate is high as well. And that when you put
Okay.
your finger in the mouth, the infant they should just grab on and suck it in the very beginning of life from up to 4 months. That's an
Okay.
instinctive sucking reflex. And then you want to make sure that they're not gagging, choking,
Sure.
which would cause them to have colic reflux, silent reflux. All of those
Right.
things could be a result of that. And on that note, every baby, unless if you've ruled out, if you think something's really seriously wrong, I like the way you said you knew something wasn't right, and
Yeah.
that you persisted
Yeah.
to find the answer. That was really good, because when we know, when I see an infant myself, I can tell sometimes that something's really instinctively not right with this infant. Okay.
Yeah.
I'll give you one example from practice in a minute of a colicky baby. But when an infant is screaming and crying and you know something isn't right, it's disruption to like it could be from the tongue tie, it could be from nervous system interference. So those are not normal signs. An infant should not be going from screaming 24/7 or be screaming 3 hours a day for every day of their life.
Right.
It's not proper behavior. And sometimes parents don't know that because if it's a first infant. So I'll
Or
tell
they're
you,
actually being told, no, it's normal. Some babies are just colicky. I mean, my
yeah,
pediatrician said that to me. So
yeah, they'll grow out
that's
of it by the time they're a year.
yes.
That's what
Stick
usually
through. You're okay.
happens. But just you live with the screaming and being up sleep deprived for 12 months first. So
Right, exactly.
um so I had a baby that came to me. Actually, his mom had a friend who was a chiropractor in a different state. So the baby was 3 months old, colicky from birth, screaming 24/7. She came into our office and he screamed. You could hear him from my office to the Burlington Mall.
Oh my
He,
God.
and so I examined him, and he had been placed on um, the first medication that he was put on was Prilosec, and
Okay.
Prilosec wasn't working. So
Mm.
the next month or 4 weeks later, the doctor put him on Prevacid. And then a couple weeks later, he added Zantac. So now I got a 3-month baby who's been on medication since he was 2 weeks old, 3 of them. And those medications, if you look at their side effects, they're really harmful. And 3 at a time, it's going to affect the liver. So before she left the office, I said, come on out to the reception room. We're going to get on your cell phone. You're calling Children's Hospital and you're going to go get a blood test for this baby right away. Because I had asked her, and the pediatrician did not do any blood work to check liver enzyme levels with all this medication going to this little baby, right?
Mhm. Yeah.
So she got to Children's Hospital. They did the blood work, and his liver enzymes were 100, 100
What is
times normal.
Oh, wow.
Okay.
That's so sad.
And so that day I saved a baby's life.
That's
And
crazy.
yeah. And he, within about 6 weeks was perfectly fine, normal, stopped crying. And then he was weaned off of his meds right away because of the liver enzyme issue. And he grew through his milestones
That's
perfectly
amazing.
normally. Yeah.
See, like that's incredible that you were able to like they came to you and then that's
Yeah,
amazing. Yeah.
exactly. Who knew?
Right?
But
Not the
so,
doctors.
sometimes, like, if I think I always go with moms and dads, like parents instincts.
Right.
You've
Yeah.
got, best. You know best when something's not right with your child.
It's so true. I didn't know it until I was doing it like, oh, this is what they mean by that. Because
Yeah.
I was like not gonna take no for an answer. I just kept going. So
So Christina, I want to thank you so much for
yes.
coming on today and doing this. I think it's a really important, it's going to be valuable and I hope it helps many parents that
Yes.
we're doing this. We're going to do a few more. We're going to do one on what the importance of pregnancy and
Mhm.
chiropractic, right? You asked about
Yeah,
that.
that'd
And
be
then
great.
the older child.
Yeah.
How do ties affect the older child if you were to not choose not to do the release in infancy?
Yes. I think
So
that'd be awesome. I appreciate your time too.
absolutely. We'll get to those topics. And
Perfect.
yeah, it's been a pleasure.
Sounds good. Thank you.
Have a great day.
You too.